Today I will be teaching on adverse drug reactions, ADRs, affecting the cardiovascular system, its causes, effects, and clinical management. This is presented by Ailey's Healthcare. What are adverse drug reactions? Adverse drug reactions are unwanted or harmful effects that occur when a medication is taken at normal doses for prevention, diagnosis, or treatment. They are different from overdose or medication errors. They happen even when drugs are used correctly. ADRs can range from mild, like dizziness or nausea, to severe, such as organ damage, life-threatening arrhythmias, or stroke. They are a major concern in healthcare because they can lead to hospital admissions, prolonged illness, or even death. These reactions may occur immediately after taking a drug or may develop after prolonged use. In some cases, ADRs are predictable based on the drug's known effects, for example, a blood pressure drug causing low blood pressure. Why adverse drug reactions happen? Drugs' pharmacological action, for example, lowering blood pressure too much. Drug interactions, for example, combining two drugs that affect the heart. Patient-specific factors such as age, kidney/liver function, genetics. Incorrect dose or long-term use. Adverse drug reactions affecting the cardiovascular system. 1. Hypertension. Certain medications can raise blood pressure. Common causes. Antidepressants like venlafaxine, especially at doses above 225 mg, where it affects both serotonin and norepinephrine. Decongestants like pseudoephedrine. Steroids such as mineralocorticoids, adrenocorticoids. Herbal products like licorice and St. John's wort. Oral contraceptives, non-steroidal anti-inflammatory drugs. Substances like cocaine, nicotine, and anabolic steroids. Cancer drugs targeting vascular endothelial growth factor, VEGF. Important interactions. Combining pseudoephedrine with monoamine oxidase inhibitors, for example, phenelzine selegiline can cause a hypertensive crisis, which is a sudden, dangerous rise in blood pressure. Key advice. Avoid combining stimulants with blood pressure-raising drugs. Maintain adequate fluid intake to prevent dehydration. Avoid alcohol as it can worsen low blood pressure. Monitor blood pressure regularly, especially during dose adjustments. 2. Postural, orthostatic hypotension. This is a sudden drop in blood pressure when standing up, leading to dizziness or fainting. Common causes. Alpha blockers, for example, prazosin, doxazosin. Angiotensin-converting enzyme inhibitors. Diuretics. Antipsychotics due to alpha-1 receptor blocking. Vasodilators like hydralazine and nitrates. Opioids. Antiarrhythmic drug quinidine. Why it happens. These drugs reduce vascular tone or blood volume, making it harder for the body to maintain blood pressure when changing position. Key advice. Stand up slowly to avoid dizziness. Take first doses of alpha blockers or ACE inhibitors at bedtime. Choose antipsychotics with less alpha-1 blocking effect when possible. Maintain adequate fluid intake to prevent dehydration. Avoid alcohol as it can worsen low blood pressure. Monitor blood pressure regularly, especially during dose adjustments. 3. Myocardial ischemia, heart attack risk. Some drugs increase the heart's oxygen demand or reduce oxygen supply, triggering chest pain or heart attack. Common causes. Thyroid hormones such as levothyroxine if started too high. Stimulants such as amphetamines, caffeine. Beta agonists, for example, asthma drugs. Sudden withdrawal of beta blockers. Triptans and ergotamine used for migraines. Theophylline, short-acting nifedipine. Hormonal contraceptives. Important precautions. In patients with heart disease, start levothyroxine at low doses and increase slowly. Avoid triptans and hormonal contraceptives in patients with a history of heart attack. 4. Peripheral vasoconstriction, Raynaud's phenomenon, deep vein thrombosis risk. This involves narrowing of blood vessels, reducing blood flow to extremities. Common causes. Non-selective beta blockers, triptans, hormonal contraceptives, safer alternatives. Use cardioselective beta blockers like atenolol. Use drugs with vasodilating properties like carvedilol or labetalol. Key advice: avoid non-selective beta blockers in patients with Raynaud's phenomenon. 5. Hemorrhagic stroke, bleeding in the brain. This is a serious condition where bleeding occurs inside the brain. Common causes: anticoagulants like blood thinners. Thrombolytics, for example, alteplase. Antiplatelet drugs. Important rule: these drugs must be avoided in patients with a history of hemorrhagic stroke. Thrombolytics are strictly contraindicated. Control blood pressure strictly to prevent rebleeding. Monitor for signs of neurological deterioration. Use alternative therapies when possible. More bleeding equals more brain damage equals higher risk of death. 6. Arrhythmias, abnormal heart rhythm, and QT prolongation. The QT interval represents part of the heart's electrical cycle. When prolonged, it increases the risk of a dangerous arrhythmia called torsades de pointe, which can lead to sudden death. Risk factors: electrolyte imbalance such as low potassium or magnesium. Drug interactions: pre-existing heart conditions. Female gender has naturally longer QT interval than males. Genetic predisposition, for example, congenital long QT syndrome. Common causative drugs: antiarrhythmics, for example, amiodarone, quinidine. Antibiotics, for example, erythromycin, clarithromycin. Antifungals, for example, ketoconazole. Antimalarials, for example, chloroquine, quinine. Antipsychotics, for example, haloperidol. Antidepressants, for example, amitriptyline, citalopram. Fluoroquinolones, for example, levofloxacin. Important warnings: avoid combining multiple QT prolonging drugs. Avoid drugs like citalopram in patients with prolonged QT. Grapefruit juice can worsen drug effects. 7. Atrial fibrillation, a condition where the heart beats irregularly and rapidly. Drug-related causes which is rare. Antidepressants, for example, trazodone, fluoxetine. Alcohol. More common causes: hypertension, hypothyroidism, heart disease. Infection. Diagnosis: absence of P waves on ECG. 8. Bradycardia, defined as a heart rate below 60 beats per minute. Common causes: beta blockers, calcium channel blockers such as verapamil, diltiazem, digoxin, clonidine, carbamazepine. H2 blockers, dangerous interactions. Beta blockers plus verapamil leads to severe slowing or cardiac arrest. Beta blockers plus diltiazem leads to increased risk of bradycardia. Key advice: monitor heart rate closely. Educate patients to check their pulse at home if necessary. Encourage patients to report palpitations or fainting episodes immediately. Adjust digoxin dose to maintain heart rate above 60 beats per minute. Easy mnemonic: A, B, C, D for bradycardia drugs, A for amiodarone, B for beta blockers, C for calcium channel blockers like verapamil, diltiazem, D for digoxin. 9. AV node arrhythmias. These involve impaired electrical conduction through the heart. Common cause: toxicity from tricyclic antidepressants like amitriptyline. Key point: amitriptyline can trigger dangerous arrhythmias, pro-arrhythmic effect. Final summary: ADRs affecting the cardiovascular system can be serious and often involve blood pressure changes high or low, heart rhythm disturbances, reduced blood flow or clotting issues, prevention strategies, careful drug selection, monitoring vital signs, BP, heart rate, ECG, avoiding harmful drug combinations, adjusting doses for individual patients. Thanks for watching this video. Please subscribe, like and share.